Hey guys, so last week I did a video about whether or not my extractions hurt. Long story short, no, they didn't hurt. It was the shots that hurt. If you missed that video, it's probably because you're not subscribed to my channel. So go ahead and click the subscribe button. I'll also link it up here. It's a 50-50 chance that I'm right. I'm going here. That's where it's going to be. And if it's not, then I will get it right next time. But today's video is about what actually did hurt me as a denture wearer. It's so easy for me to forget that because it's long behind me. Even when I wore dentures, the pros of having dentures, all of the benefits that I saw from wearing dentures tended to kind of mask the pain that I had. And so I occasionally have to dig in my older videos just to jog my memory and remember how bad it did get very, very infrequently. So that's what we're going to be talking about today. And this video is sponsored by Ivoclar Vivadent. If you didn't know, Ivoclar is a dental manufacturing company. They are all over the world. Their headquarters are in Liechtenstein. Go on and say that a few times. They're an amazing company that produces all this cutting edge technology that dental professionals use and that they end up using to treat us, like my teeth. And I'm thankful that Ivoclar is really big on patient education, and so they have sponsored a lot of my content here. If you want to learn more about them, click the link below. It's www.morethanAdenture.com. I oftentimes, not because I'm lying and trying to hide things from you guys, I oftentimes say that being a denture wearer was a breeze and I never really experienced pain. You forget how bad things are sometimes because the benefits outweigh all the bad, just like childbirth. Any of you moms out there or dads that had to witness it, you remember the trauma that came with that, but then afterwards, it's so hard to remember those things. But I did have pain, and my pain was all centered around poor fitting dentures. So I think it was the second week of being a denture wearer. The first week was like swallowed up by swelling. It was just, I was consumed by how big my face was and the pain that came with that. And there was some bruising and whatnot. I've mentioned before, I went to the emergency room because I thought something went terribly wrong and it didn't. But then into that second week, when the swelling started going down, the dentures started moving around, and that's when I started to experience pain. Another thing that I forgot about is that during that time, apparently, when I got those immediate dentures, when they were placed at the time of extractions, there was a temporary liner that was put in there to make sure that they were fitting properly. Because you got to remember, my impressions were done when I had teeth in my mouth. So I went to the dentist with all of my existing teeth in, and they did impressions and based my denture off of those impressions because I went, got the extractions, and immediately got the dentures. They weren't back there in Santa's toy shop whipping up a set of dentures. They had to go off of the measurements that they had, and those measurements are not always exact. And so I completely forgot that they did put a liner in there so that the dentures that they made based on previous measurements would fit to my gums as they were after the extractions. And so there was a liner that was put in there. Well, there was a lot going on. I had alveoplasty, the extractions were surgical, so I ended up with stitches. So my gums were already kind of sore and everything was very swollen. And then there's this liner in there. So into the second week, as the swelling went down and things started to kind of settle, the dentures became loose, and that's completely normal. But also the liner, the temporary liner that was put in the denture began to crack. And in certain spots, it became a little bit jagged and started piercing into my gums. Not stabbing me, but just enough irritation to already irritated gums to cause me tremendous pain. As a matter of fact, that's the worst pain that I can recall ever having at any point as a denture wearer, was that second week when they became loose. And there was no functionality to the dentures that week. I could not eat with them. I could barely talk with them. Just moving my mouth around hurt because every time I'd move, they would shift and rub and create these raw spots on my tissues. But I decided to tough it out and deal with it the best that I could because my dentist told me that it was going to be a little painful for me in those first couple of weeks. And I had my 2-week appointment scheduled where we had a new liner put in. A reline was done. And for those of you who don't know what a reline is, it's where they take this goopy stuff that they put into your denture and then they stick the dentures in your mouth and you bite down, and that stuff molds to your mouth. It causes the dentures to fit like a glove, okay? And so in doing this, not only did they fit better, but they were able to push the dentures back in my mouth further to where they had a natural setting, if that makes sense. Because before, they were all bucked out. Like they were all, it was huge, it was a mess. I couldn't foresee that that could ever be corrected. Like, how do you fix that? This is where they're at. But when they did the reline, all of that was fixed. But the most important thing was that the fit was better. And because they fit properly and they were not moving around in my mouth, I was not getting those sore spots. There was no pain. If your dentures are loose, they can sometimes, especially for me with the bottom denture, it digs down in there. If there's not enough support there, if there's not enough keeping those dentures sitting up on top of your gums, then they could sink as your gums shrink, as the swelling goes down, the denture starts to sink and burrow into your cheek down here, and that can really, really hurt. And if you allow that to go on for too long, then you'll get sore spots. It will rub the tissue raw, and then that can be a breeding ground for bacteria and infection. So you definitely do not want to go at any point with dentures that are not fitting properly. During the first year with immediate dentures, if that's the route that you choose to go, you're going to have to get adjustments. It is expected that you go back and get them adjusted. They can have you bite down and determine, okay, well, you know, is this shrinking faster over here than this? Is it getting lopsided? Is it throwing your bite off? They can put liners in there to keep them level, address occlusion issues, which is like when your teeth come together, that there's not one side hitting harder than another side. They can adjust all of that. If the dentures are going too far back in your mouth, they can do adjustments to where they shave a little bit down here and there. Like there's different things that they can do to make sure that these dentures are not creating a ton of pain and problems for you, because honestly, you shouldn't have pain. You should not be having pain. And if you have pain, that means that something's not right, and you need to address that with your dentist and schedule an appointment so that they can determine what's going on there. The next thing that caused pain, which is, it's the same thing. It is, for me, it was always the fit. The fit was off, and once it was corrected, all was well. Here's what I did. That's my first set of dentures. And I've showed you these gross things before. Here we go. That is the temporary liner that I did myself. That's what, that should not be. Like, you should never have dentures that look like that. That was my lazy way of relining my own dentures to save some money. This is stuff that I ordered online. I don't even know what it's called. I don't even know if they sell it anymore. But you see this liner here it's coming up, and it's all lumpy. So that means every time you see these lumps and bumps, that's something that is putting pressure on my gums and making it very miserable for me just to have, you know, dentures that fit. And the funny thing about it is they didn't fit. I looked like a horse. When I did this right here, I did not nail it. It was a disaster. It was a disaster. I put too much in there, and the teeth came down too far, so you could see all of this here, and it threw my bite off. I couldn't eat properly. It looked insane. Okay, so don't try to do your own reline. You know, like, leave that to the professionals that have actual good quality material. I mean, look at that, really, seriously. Look at this camera is all out of focus. Okay, that cinematic mode on iPhone is like, it's a train wreck. But anyways, here's a better view. And they're dirty because they've just been like sitting on my desk. I don't really do anything with these, but use them for demonstration purposes. But like, really look at how bad that is. And that's what was in my mouth. You can see it kind of spilling over on the sides, and then it's not the best quality material, so it gets rough. Even if you soak it, it's rough. And then just imagine all of the bacteria that would get trapped in these little pockets that I left in there. Like, good Lord, I am not a lab technician. This is not my forte. That hurt. That hurt. When I did that, it hurt. Here's another example. This is the bottom denture. Same thing. Like, it just was not a good idea. And so all of the pain that I experienced as a denture wearer was from poor fitting dentures. And when I say pain, I mean actually can't eat with them, can't talk with them, can't do anything real pain, and you should never have to endure that. So if you're experiencing any kind of pain as a denture wearer, it's not the norm. It's not something that you should just accept because you're a denture wearer. You don't grin and bear it. Like, that's a nice pun. Grin and bear it, teeth, dentures. Okay. And I think that a lot of people don't realize that. I think that people assume, okay, well, I've got dentures. This is a new reality for me now. This is how they feel. It kind of sucks. I'm gagging. I can't really eat with them. It hurts, like different things like that. And you don't realize that they're not normal. You don't realize that that's not the way that it's supposed to be. And there are things that can be done to correct these issues. So make sure that any pain that you're experiencing, you address that with your dentist and see what kind of solutions they can offer you. So that was my experience with pain as a denture wearer. All easy fixes, a simple trip to the dentist and a new reline and a little bit of shaving here and there. All those issues were resolved. What are your experiences? Are you in pain right now? How long have you had dentures, and how long have you been in pain? What kind of pain are you experiencing? How has your dentist addressed the pain that you experience as a denture wearer? Leave it in the comment section below so we could share experiences and stories and potentially help somebody dodge a bullet, because you shouldn't be in pain. So that wraps it up for today's video. Make sure that you subscribe to my channel. Most of the people that watch my channel are not subscribed to my channel. Subscribe. It supports what I do. It boosts me in the algorithm so more people can find my videos and potentially get the information that they're looking for. Click the bell notification so you're notified whenever I post videos. I post every Monday and Thursday. Another thing, last week, if you missed it, was I had my big debut with ASAP Dental Care here in Jacksonville. They are sponsoring a lot of my Thursday videos now. We did a video about the hybrid cleaning, so I showed you guys in the office how we got these bad boys that are screwed into my mouth, how we got those clean. Next week, we're going to be discussing the topic of fear with a very, very sweet dentist that kind of reassures us and walks us through how to deal with that fear of going to the dentist and what the dentist might be thinking about us. Are they judging us? So you don't want to miss that either. You can follow me elsewhere online. All of my social links are in the description box below, and I will see you guys next time, and y'all take care.